Good morning, Carol Johnson.
Good morning, Bob Ponte. How
We're
are you?
here. I'm good. I'm good. We are alive. We're well, and we're here for our weekly HEN COVID-19 update. Our lead story is well. I wish we could have some good news, but
Yeah.
our lead story is that hospitalization rates have gone up, and we've seen the highest total since June. New York City had 450 hospitalizations yesterday. Statewide, it was 923. And so these are numbers that we haven't seen since the early part of the summer.
People still aren't getting it. They're still protesting. They don't realize they're protesting life.
Mm-hmm. Mm-hmm.
They're saying we want to live, but you're actually protesting life. So apparently, there are a lot of people going around that are asymptomatic who are passing this disease on. And people are still stuck in the fact that I feel fine, which means absolutely nothing.
Mm-hmm.
You can
Mm-hmm.
still not have symptoms and have COVID.
Yeah. And a lot of this is centered around the same clusters that we've been talking about for the last couple of weeks. Um, Actions have consequences, and we've been saying the same thing for weeks, and unfortunately, every week we're seeing the same thing, which is that we're in the middle of a second surge, and how deep this surge goes is really going to be dependent on what people's behavior and habits are. If people get back to social distancing and washing their hands or just staying home, wearing masks, of course, there's an opportunity to maybe cut this down. But right now, we're seeing selected outbreaks in different areas. But again, all it takes is one person driving across the bridge, going to another neighborhood, and that outbreak can be somewhere else. So once again, we have to advise people: don't take this for play. This is not a joke.
I don't know what it's going to take.
Hmm.
Um, we're seeing the numbers rise rapidly, and for some reason, people are still under the impression that it's going away.
Hmm.
I don't know if they read, if they can read, if they're listening and paying attention. I know I'm hearing more and more ambulances in my neighborhood, and I'm 10 blocks from one hospital and another maybe 12 blocks from Mount Sinai.
Hmm.
So I'm sort of stuck between Mount Sinai and Metropolitan. And being on Citizen app, I know that these are not stabbing shootings that's
Hmm.
happening now. And so I'm beginning to hear that uprise of ambulances, particularly late at night. So it's just showing that this thing is going to surge whether you like it or not. And it's time that we all pull together. You know, I'm glad, let me say this, I'm glad that finally, they've stepped up. The officials have stepped up in Brooklyn and Queens, but they should have done that a long time ago.
Hmm.
I was saying for a long time, and people were saying, "Oh, that's so cruel." I've been saying for a long time, lock them up. That'll hit home. Start locking them up.
Well, one of the lessons that we've seen out of this whole thing is that when we let politics take precedence over health policy, it just doesn't work. And it's happened on the national scale, but to a smaller extent, that's what's been happening here. Is that definitely here in New York City, politics has governed how Mayor De Blasio has taken this thing on, and there's been situations where we see the ball dropped. We're still haven't had a satisfactory answer as to why they switched health commissioners in the middle of a pandemic and why they withdrew the responsibility for contact tracing from the Department of Health, which has all the domain knowledge about how to do it, to New York City Health and Hospitals, which is are great for treating people, but they have never done that type of stuff before. So we continue to have to look at these things, and hopefully you know people are open to improving on where they're doing things that are not working. And nationwide, over the last 5 days, it's an average of 52,000 new cases per day. So this is after the president said that COVID was going away again, and not going away.
Well, it's beyond sad because you've got a leader, I have to put that in quotes, who's
Hmm.
running around saying you want to kiss people. I'm cured. It's okay. Having these mass rallies of people piled up on top of each other continually. You know, I mean, I say now, like I said last week, he's continuing to make a mockery of
Hmm.
this. In the last 11 days, 18,000 more people have died from this.
It's
Since he
crazy.
started in shenanigans, we've lost 18,000 people.
It's
Now,
crazy.
people are talking about Trump and they want to vote for him and he's the right one for the job. But ask yourself, if he was taking all of that money out of Remdesivir, did I get it right, Bob?
Yes, you did. Yep.
If he was taking money away from those trials and the Regeneron, all these different things that they gave him, the cocktail that he took, they were taking money out so that the trials couldn't continue. Now that he's running around touting that he's cured, because last time I heard there was no cure for COVID,
Hmm.
ask yourself if you or your mother or your child got it today, do you think you would be privy to the same medications he took?
Not even close.
And meanwhile, he's still pushing, they're in court now, still trying to abolish the Affordable Care Act. Now, I know some people insurance went up, but when you think about the millions, like 34 million people
Hmm.
who became insured, we're not talking about busters.
Hmm.
We're not talking about people who just didn't want. We're talking about people who did a lot of the jobs that you and I didn't want to do.
Hmm.
Sanitation, working in hospitals, working in restaurants, and did not have any health care. And now they've got it. And they are trying to strip away the only health care act because they don't have a replacement. Let's be clear.
Hmm.
In the midst of COVID, with all the people with um already people that are already sick. But what about all these people who are now infected? 7.89 million people in America is infected. How many of those people do you think is going to need health care just to survive this pandemic?
Yeah, the idea of cutting healthcare in the middle of a pandemic is, I mean, I would say it was unthinkable until 2020, but I guess this year any anything can
Anything, yeah,
happen.
anything's possible with this administration.
Hmm. So here in New York, we have a quarantine list from 38 out of the 50 of the other 49 states cannot come here. Three were added on. The latest three are Michigan, Ohio, and Virginia. So if you were planning to do any vacationing there, which I'm pretty sure you probably weren't, well, maybe Virginia, but right now, we can't go anywhere, and they can't come here.
Hey, and I know a lot of people who ran off to Virginia Beach
Hmm.
as soon as they thought the coast was clear and those numbers started to rise.
Hmm. Yep. So the other news that we've been seeing, which is also unsettling, is we're seeing more cases of reinfections. People who got the infection and then thought they were over it, and then get reinfected again. There was a man in Nevada, a woman in Nebraska, and a woman in the Netherlands who has died from the reinfection. So, as we get deeper and deeper into this pandemic, we learn more and more about it, and unfortunately, usually it's not good news. We keep seeing more and more ways that this virus can present itself and present problems, and right now our medical community is working hard, but we do not have solutions yet, other than the ones that we continue to talk about, which is about building up your nutrition system. Now, there's some interesting information or some interesting data coming out of Japan. And what's interesting about Japan, and again, a population that is very dense, and they have 127 million people. And but they've shown a higher level of they've shown high levels of antibodies in the testing, but they've also seemed to showing a higher level of immunity and a lower death rate. And so the doctors and scientists are trying to figure out what they attribute it to it. And many of them think it's the diet. Their diet is high in fish and
Mhm.
seaweed, and both of those things are high in vitamin D and omega oils. And
Omega oils, yeah.
yeah, so they're looking at these things, and hopefully there's some some more information that can be gleaned that help us. But we continue to see evidence that we've been saying tune your immune for 6 months, and we're saying it louder and stronger right now. That now is the time to to make sure you have the right nutrients and supplements in your diet to boost your immune system, so that if we're facing a second surge, at least this time we have a chance to be ready for it.
Yeah, because the lockdown is coming. This is the time when, if you weren't paying attention before, this is the time. I mean, we can't say it enough. Prepare yourself. Get food, extra food, water, non-perishable items. Check those expiration dates and start getting ready to shut down.
Mhm.
Because again, not only do we have a deadly disease, we have a disease that we are all. Remember, if you think back to how this entire coronavirus started, it started with one or two people in Washington State. It
Mhm.
started that way.
Yep.
And so now, when you look at these two people who have been reinfected, that's telling you right there that that in itself can be its own surge. So this is the time to really, really, really pay attention and start eating healthier, making sure your children eat healthier. Try to stay away from a lot of salt and sugar. There's so many different things out there that you can use to supplement. You know, I learned years ago by being, my ex-husband was a farmer in the Virgin Islands. And I loved the smell of curry, but I was allergic to it. And then I found fenugreek, and that's what I use. And then I started using sea kelp, different things
Mhm.
like that instead of salt.
Mhm.
When I did use salt, I would use sea salt in very, very small increments.
Mhm.
And, I started to like really enjoy the taste of the food. It was different, actually. I liked it better.
Mhm.
Even with my greens, I stopped putting meat in there. I started using a little bit of garlic, you
Mhm.
know, apple vinegar, apple cider vinegar, and different things. And even my neighbors are like, "Wow, Carol, those greens were banging." These are people that's used to having, ham hocks in their dreams.
Mhm.
So
Mhm.
just try these things out
Yep.
and start having them with your children.
Yep.
Be creative with the food,
Mhm.
you know.
Yep. You know, we've been talking a lot about vitamin D. You can get it from butter and milk. Cod liver oil is a very, very good source of it. Eggs are a very good source of it. Different fishes are good sources of vitamin D. And you definitely want to start building that in your system just to identify the differences between vitamin D and vitamin C. Vitamin D is what they call fat soluble, which means it stays in your system in your your fat, and so you can build up a kind of a reservoir of vitamin D. And as we said, going into the cold weather where we're not in the sun as much, it's really important to do that. Vitamin C is what they call water soluble, which means whatever comes into your system, your body uses it, and what it doesn't use, it goes out in your urine. So you need fresh fruit or or vegetables every day to replenish the supply of vitamin C, and of course that's something you can supplement. And as you can see on the screen, here are some of the sources for vitamin C. Everybody knows about citrus fruits, but aloe vera juice and broccoli and Brussels sprouts and peppers actually have it as well. You know, green peppers and red and yellow peppers. So there's a number of these sources. Vitamin E is also very, very important, and you can get that from almonds and apricot oil and hazelnuts, leafy green vegetables, palm oil, peanut oil, sunflower seeds. So you have all these sources, but I think the key is again working with natural foods and um, just making sure you have as much fresh food in your diet as possible.
Yeah, and the E is really good because it's good for the hair, it's good for the skin,
Mhm.
uh, and with all the washing of the hands and stuff, it's great lubrication for your skin.
Mhm.
So yeah, these are different things that we need to try to invest in, but you
Mhm.
know, we still just have to focus on wearing the mask, keeping socially distanced,
Mhm.
and washing of the hands.
Mhm.
That is
Yep.
key. And that means over your nose and over your mouth, not under your nose.
Mhm.
And when you're in groups of people, you need to socially distance. It's been proven that the aerosol, the spray of a sneeze, a cough, or just talking, some people spew just by speaking, you know, that will keep this spread down.
Mhm.
And again, we come into the winter and Thanksgiving and Christmas, and we really need to take a good look at this
Mhm.
now because that whole holiday season thing, Halloween, that
Mhm.
all of these things that people celebrate in
Mhm.
terms of gathering in crowds and Thanksgiving, the house is loaded up with people. You got to rethink these things.
Yep.
Now I know
Y-
family members gonna get mad and stuff like that, but we're talking about your life
You
and the
know,
lives and the health of your loved ones.
yesterday I was reading an article, and it was just different stories of people who caught COVID, and some of them were heartbreaking. Even, some of these staunch Trump supporters who tell the story about how they thought it was a hoax, and then they decided to get together with families. One story I read, it was so tragic. So the family decides they've been locked down long enough, they'd get together and nobody would wear a mask. And after that, like 8 or 9 people out of the family got sick. They lost the parents, and the person who wrote the article was hospitalized. He's still alive, but he's racked with guilt because he's lost they've lost the elders, and the other family members are still fighting through it. And it's just, these stories are tragic. But when I hear these stories, and what I've seen locally is that, people are getting together, and they're not always wearing masks, and they're not always social distancing. And we keep saying it, and even if we sound like a broken record, if one extra person hears it every time we say it, we'll say it again, because we are watching the information that comes across. We're following the story, and we want to put the story to bed. I'm looking forward to the day where we just say, all right, we don't have to do COVID-19 reports every week, but that hasn't come at all. Um,
Right.
we had some fortunate time in the summer where here in New York, we were able to flatten the curve, but we started talking about it in late August, early September, and the numbers are bearing it out. So it's time for people to just take an assessment of what's going on. We know that things have opened up again, um, but opening up again doesn't. COVID doesn't care. COVID actually doesn't know what's been opened up or not. It's just looking for an opportunity to jump from people to people. And if there's people around, you know, COVID will crash the party.
Yeah, because I find it interesting when I've seen groups of people socially distanced with
Mhm.
masks on, and then when it comes time to picture taking, everybody's heads are up on top of each other and the mask come down
Right.
for a photo op.
Mhm.
And if one, two people have this virus and you're vulnerable, that picture op can turn into a trip in the ambulance and never to return.
Mhm.
You know, it's almost like we were looking at this thing like the AIDS virus. I remember how
Mhm.
so many people saying, well, I was with them, they didn't look sick. Well, the people that's asymptomatic don't look sick either,
Right.
and they don't have symptoms. That's the
Mhm.
part that we got to get in our head. They Lots of them don't have symptoms.
Mhm.
And the other thing you got to remember is even if you're taking temperatures, that does not mean that that person is not COVID positive.
Mhm.
And I know a lot of families are doing that. Oh, we got our temperature, we got our thermometer, and we taking all family members before they come in the house.
Mhm.
If you have no symptoms, there's a real strong possibility you're not going to have a fever either.
Right.
So that's no bueno. Socially distanced. Family members are going to get mad. Maybe you need to split it up instead of everybody coming to June house. Half of y'all go to so and so house, and another half go to the other side, and y'all FaceTime people. Because I'd
Mm.
rather FaceTime my family in another location than to FaceTime them when they're breathing their last breath.
Right.
And a nurse has to, FaceTime my last look at them while they're alive
Mhm.
in the last minutes of their lives.
So we also learned that Dwayne the Rock Johnson and his entire family has been infected with COVID, and according to them, they got it from a close family friend. So once again, it's the same situation where somehow people are acting like they're safe if they just you know don't social distance with everybody else except their friends and family.
Right,
And there's really no way for you to determine whether your friends and family have it or not. So
right.
it's it's tricky.
And let's look at this guy, how much he works out, how healthy he is,
Hmm.
and his family, how well they eat. So don't get caught up again in um the myth that only old people with underlying illnesses can even get it. People think that, but I'm healthy. I wouldn't get it. That's just not true.
Mm-hmm.
That is just not true. So, but the better that you take care of yourself, and just like with this gentleman who does eat healthy, and his family members, they eat healthy, they exercise on a regular basis. But the part they missed was the socially distancing part. They ended up being positive.
Mm-hmm.
So it's not an either or. It's a one plus one plus one. Mask, social distance, wash your hands,
And tune your immune.
and tune your immune.
It's four things. We can't make it simpler than that, but you got to do all four, you know,
Yeah,
or or not. But you see what the consequences of not doing this are. You know,
yeah,
as we, what did we started this thing out talking about how hospitalizations are now up to where it was in June. We don't want to see it go up to where it was in April. Um, so whatever you do, you must protect yourself.
yeah, and that's why I said really start thinking now about the holiday season. It's upon us.
Hmm.
And I want to see everybody that's here now go into 2021.
Hmm.
But this is the time to really, really be vigilant because we didn't see this. We were on the brink of spring when this started. The weather had started to warm,
Hmm.
but now we're going in the opposite direction.
Hmm.
You know.
And we're also seeing in Queens there was an EMS station that had five suspected cases of COVID at the same time. So they're all on medical leave. And we've had over 5,000 members of New York's fire department have had a positive COVID diagnosis. So, this is what we see. People who are first responders put themselves on the line with this. And this is why it's so frustrating when other people have such callous disregard, not just for their own health and the health of their families, but the health of people whose jobs it is to keep us safe. And they can't do it because people are ignoring protocols and just doing what they feel like is their right or whatever, or their, um, you know, and there's no religious justification for not wearing a mask. There's nothing in the Torah says you can't wear a mask. There's nothing in the Bible about wearing masks, and so anybody who's making these complaints on religious grounds is just, it's just not really true. Because there's one thing where there are practices that are born of your religion, but every religion has practices that are just really, social practices. Um, and so we understand, the religious practices, the social practices have to go. So, it's tough that people can't meet weekly the way that they used to, but the one thing that we've seen in COVID is that it doesn't discriminate amongst religions. We have seen, Muslim clerics and worshipers die. We've seen Christians die. We've seen Jewish die. Um, COVID has not spared anyone. Um, anyone who does not take it seriously can get it. So.
Yeah, we saw masses of people getting infected in church services. That you
Mm.
know that that was an early warning.
Mhm.
I don't even understand how 7, 6, 7 months later that people have not gotten that message.
Mhm.
When 200 people, 140 ended up being infected. 200 people, and well, one was about 1,000 people. Wiped out the whole entire pulpit. Every pastor on the pulpit gone.
Mhm.
Last I had heard, at least 115 people in that was infected, and that was early on.
Mhm.
Now the brazen attack against something that is taking lives. What part of that are these people not getting? We're having bonfires of masks,
Mm-hmm.
burning masks in defiance. I mean, I don't even understand. I don't.
Yeah,
I,
the whole
I, I don't.
mindset. It's
I don't
like
understand. I can't even rationalization behind that.
like
It
okay,
just,
it's one thing. All right, now you don't want to wear the mask, but now you're gonna go out, gather with other people, and burn a mask, a perfectly good mask that somebody else could have worn to protect themselves, and you're doing this to make a statement, and the statement is what? You can do what you want to do, and you don't have to listen to anybody else because you're grown. That's not how it works. You know, there's
I just know that we couldn't have done that on 125th Street or in
and
Elbadia. I know
boy,
that.
boy,
We couldn't have done it and survived it.
I could say if we did it, we'd have done it once, and we wouldn't have done it again because there would have been mass police presence. There would have been batons, pepper spray, whatever, maybe rubber bullets. Who knows? Maybe real ones. Um,
Well,
you
if you
know,
remember that clip that you couldn't play last week, that's what it showed, the
the,
pushback.
right,
They were
exactly,
literally
right.
pushing the cops. We
Hmm.
wouldn't have gotten that far.
No, not at all, not at all.
I mean, and this went on, and one they were surrounded and just pushing the cop back and forth, back and forth, back and forth, and others was trying to help when they start pushing him too. They just
Hmm.
literally ran the sheriffs. What were they? Sheriffs, some kind of deputy sheriffs from some county
Hmm.
came out. They ran them back to the car. The people took off, never to be seen again.
Hmm.
This is what's going on. That was before the burning of the mask. Now they're burning masks. But
Hmm.
the one good thing is that the rabbis, with common sense, you know, um, they're trying to socially distance. When the people come in, they're passing off that message. These are the things that we have to do. It's those in defiance. You
Hmm.
follow defiance, you very well may end up dead.
Hmm.
It's it never stops. There's the
Yep.
ambulance now. You
Yep.
know,
I hear it. Yep.
yeah.
So I want to bring up one last thing. We talked about it a little bit last week, and I wanted to just kind of repeat it because I felt like it was new information, and we want to continue to share it. And this was we talked about oximeters, and oximeter is a device that you can get to measure your blood oxygen level, and we talked about this in the context of this measuring blood oxygen level was what they used to trigger taking President Trump out of the White House to Walter Reed because his levels dropped down dangerously low. So we know it's hard for us to determine exactly what's going on because he lies so much. But the fact is, we this part is documented that he had poor blood oxygen levels, and when they saw it, they said they grabbed a helicopter and they took him out of there. And why this is important for us, this is not about Trump, this is about us. We want to remind people that this is a way of determining if someone has a COVID infection and things are worsening, that blood oxygen level is a real indicator. And the reason why we bring this up is that these devices are available. You can get them in the drugstore. They only cost maybe about between $15 and $25. So we wanted people to realize that this is something that you could have at home, or you can buy it, or if someone, let's say you have a family member who's been diagnosed with COVID and they are basically at the house. Now we have talked before in advance, and we'll repeat this again, that if somebody is in your house with COVID, you got to take a special set of protocols to quarantine them. At the same point in time, what you want to do is you always want to be monitoring them for worsening symptoms. But now with the oximeter, it also gives you another device, another way to just determine where they actually are. Because one of the problems with COVID is that it can be very sneaky, and when it's worsening, a lot of times people don't realize until it's very, very late in the game, and by the time people get to the hospital, they're already in serious condition. So we wanted to remind people about these devices. It's called an oximeter. It's called an oximeter because it measures your blood oxygen. It's very simple. You put it on your finger, a little dial comes up. I'm going to bring that picture back up again. As you can see on this one, it says 94. And from what I've read, and again, I am not a doctor, do more research on this of your own. But if it's 92 and above, that's a good number. If you see that number go below 92, it's probably worthwhile for you to get help or put yourself in a situation where you can be monitored more closely. So we wanted to just share that information. You know, we're here to give you as many tools as possible to defend yourself from this pandemic.
And the device would tell you exactly how it should read. So you would have instructions. It'll give you a range, so
Hmm.
that much you will know. But these are just good things to have. If ever
Yeah.
there's a time to make a little sacrifice, I mean, yeah, we just they just opened up the Taste of Seafood down the block from me. They had a fire. They just opened up,
Hmm.
and I have to avoid that block. I have to avoid that block because I want to go in there and get me some whitings.
Right.
But I have to think in terms of other things that I need. There's another ambulance. Other things that I need, sacrifices that I have to make for my well-being.
Hmm.
So these are investments that you can't even say it's waste. It's like when you buy extra food and extra uh beverages and water and teas and stuff like that, that it's a waste because I didn't use it. Why? You're gonna eat it anyway.
Well, you
Sooner or
know the
later
saying is
you're gonna drink it.
it's
you know
better to have and not need than need and not have.
exactly. So whatever precautions you can take. And again, we can't stress enough that winter is coming. That means people are going to be locked in, and people will still be going out to work, and they'll be coming back. So you still have to maintain those protocols, sanitizing things, sanitizing your kitchen area, sanitizing the handles on the toilet handle, the
Mm.
faucets. Sanitize them. Just wipe them down, because people are going out and you don't know what they're bringing back. And just because you were, I mean, the one thing that was very pertinent that was said in the beginning, you go, you test, you get your results. If you don't follow protocol, there's no concrete way that you are going to be absolutely safe between getting that result and getting home. You can pick it up, you can test negative and pick it up on your way home
Yep.
if you're not practicing, the protocols. It's that simple. That's why they kept telling people it doesn't matter if you go and you take a test and you're still living dangerously and you're not following the precautions, you're actually putting yourself back in a place of danger.
Hmm.
But I still hear people saying, now I tested negative, I'm immune. There is no such thing right now. Now they may find that later on, but right now there's no such thing as being immune. Do not listen to the friend of the fly, the 1600 what 1600 Pennsylvania Avenue. Because those flies are kind of weird. They must be partnering up. One sat on
On
Tony Berry's shoulder too. I don't know if
yeah.
that's the same one that sat on Pence's head, but
Hey,
it's funny.
that
You
fly
move, flies move when
that
you
fly
move.
is
But he
working.
sat there patiently.
Well, those were the flies were in different cities, so that's think about that. I mean,
Oh, they're just following them around.
yeah, yeah. Well, you know what flies get attracted to, right?
Okay,
So
okay. I
say
didn't want
no
to go
more.
there, Bob.
Say no more. Figure it out. That-
I didn't want to
right.
go there, but
Well, it's right in
I
front of
mean,
us.
yeah, this is for real, for real. We can't play with this thing.
Yep.
We
So,
cannot play with it.
I think we're gonna wrap here. We want to remind people, obviously, to stay safe and use the protocols. Remind everyone that above all, we still have to find a way to vote. I know a lot of people are voting by ballot. Some people are, still taking the risk, as I am, to go out and vote in person. I will be wearing a mask. I will be distancing. I will be have my hand sanitizer with me, and I'm gonna go out there and put that vote in there because that's how important it is. Because the fact is that if we had had the voting where it was in 2016, we might not be facing the depth of the problems that we are right now.
Yeah, and if anyone knows, has any friends or family members in California, please inform them that illegal ballot dropping boxes are being placed around California.
It's
And,
crazy.
this is another way to affect your vote. These are
Hmm.
illegal boxes. They are not from their board of elections. It's another way to stop your vote from mattering. So vote early or go to your polling site on that day, but be very, very careful. And they're even asking people now because they're doing so many things with the mail to even try not to drop absentee ballots in the mail. If you can, just get to a polling site.
As
You
we
know,
get closer to the election, I think we'll try to have some information on numbers you can call on the day of the election to report any irregularities. It's important right now for us all to work as a community. This is how we've come through everything, and this is how we're going to come through this. So,
yeah, gather up some people. You got some elderly people in your building. Take them. It's safety in numbers. They'll feel comfortable. A group of them, the same way they go to the senior center. To get a group of them, take them to the polling site. Assist them with filling out the ballots. Call them, check in on them. You know, because in the beginning, um, the moniker was vote as if your life depends on it. That's changed. Vote because your life does
Done.
depend on it.
Yep.
And so, New Yorkers, you can get out there and vote early. I'm taking advantage October 24th, Saturday, October 24th. You can check with the Board of Elections for the exact time
Hmm.
that they're opening up, but they will be open. Get out there early if you can and cast those votes.
Yep.
Before we go, I'd like to send condolences to the family of Manchester, Tennessee's mayor, Mayor Lonnie Norman, who was taken by this horrendous disease. We offer condolences to this brother's family, his wife, his children, and his loved ones, and his community.
Yeah.
So that's another way of saying that it doesn't discriminate. It's taking out the officials too.
Hmm.
And ironically, Tennessee was one of the states that let the mandate on the masks expire.
Hmm.
This is a man who served 40 years, some form of service to his
Hmm.
community.
Hmm.
And they allowed that mandate to expire. So now, you know, rest in peace. We wish you well on your journey.
Yep. All right, so that's it for us. We're back next week, same time, 9:30. We ask you if you're watching us on Facebook, please like us and share the information. If you're watching us on YouTube, Please subscribe. We're Harlem Emergency Network, and we're here for our community.
Have a great week, everyone. Stay safe.